Hello, my name is Joe Golden with Adimend Biosciences, and Adimend has developed some proprietary technology. It's a dual syringe system, and it's for in-office autologous stromal cell therapy using fat, and we're treating osteoarthritis and chronic wounds. The dual syringe system consists of three parts. One of them is the aspiration syringe, which is the larger syringe. The second is the smaller injection syringe, which is actually attached to the larger syringe. And I'd like to point out there's a channel connecting both syringes. And the third item is the PAAC, which is a percutaneous adipose aspiration cannula. And how they work as a system is we're going to get the PAAC and we'll place it inside the body with a puncture. There's a needle in this percutaneous cannula, and we'll puncture through the skin, get to a desired depth, and we'll take the needle out, toss it, and then we'll connect the aspiration syringe, and then using negative pressure, not powered, we'll begin to aspirate fat tissue. And we'll end up with about 50 mLs of fat in the syringe. We're going to place it into a centrifuge, and we're going to spin it for a very exact time period and a very exact speed. And what we're doing is concentrating the stromal vascular fraction, the SVF. And the SVF is loaded, it's very rich in mesenchymal stem cells. And mesenchymal stem cells, data shows, contribute to tissue regeneration. In fact, I'm the patient number one. Had a sports injury last summer and had an MRI, and my right knee showed to have torn meniscus and early stage arthritis. We were able to duplicate our technique in a local physician's office, and we took about 50 mLs of fat from my abdominal area. We spun it centrifuge, concentrated the SVF, and re-injected my right knee. I'm happy to say it's almost pain-free 7 months later. So it feels good. Our target market is the treatment of osteoarthritis by rheumatologists. There's 35 million Americans who suffer from osteoarthritis, and in fact, osteoarthritis was the second most expensive condition treated in the U.S. in 2011. The dollars spent on treating osteoarthritis, short OA for short, is approaching $15 billion, almost 4% of all healthcare dollars spent. Another target market is the treatment of chronic wounds by the general surgeon. Right now, there are 8 million existing patients suffering with chronic wounds, and every year an additional 1 million patients develop chronic wounds. So we plan to keep an eye also on the hyaluronic acid injection market. Hyaluronic acid is used to lubricate joints, not for tissue regrowth, but just for lubrication of the joints. And the recent data shows that it's not as efficacious as once thought. So if that product gets pulled off the formulary, docs will be scrambling, rheumatologists and orthopedic surgeons will be scrambling to make up for lost revenue. In fact, there was one large pharmaceutical company last year, actually in 2013, that booked $371 million selling in hyaluronic acid injection cells. Well, with also all the recent changes in the healthcare market, physicians are actively searching alternative sources of income due to continued cuts in reimbursement. Physicians are also trying to do more and more procedures and therapies in their office, running more of a retail physician practice. We believe Adimend's dual syringe system and the PAC fit perfectly into this changing environment. We plan to launch the dual syringe system with minimal headcount, selling direct as well as through distribution in key areas of the U.S. And along with the dual syringe system, Adimend has a very robust pipeline, and we need funding right now in the amount of $325,000, and we would love to have you join us launching this exciting technology with us. My name is Joe Golden with Adimend Biosciences. Thank you.